Accessible research summary. Racial healthcare disparities for children with autism and developmental disabilities. Many healthcare providers do not understand the unique needs of people with developmental disabilities, including autism spectrum disorder, or ASD. Cultural differences between providers and patients can also create challenges and negatively impact outcomes. Compared to white children with ASD, children with color with ASD tend to be particularly underserved, having less access to healthcare and receiving poorer treatment, also called disparities. For these reasons, the purpose of this study was to figure out if racial and ethnic disparities for children with ASD and other developmental disabilities reduced between 2005-2006 and 2009-2010. The study was particularly interested in the quality of provider relationships. The National Survey of Children with Special Healthcare Needs, or the NSCSHCN, was used to examine this. Key findings. Racial disparities were evident for 4 out of the 5 provider quality measures in 2005-2006 and 2009-2010. In 2005-2006, Black and Latino parents were less satisfied with their provider, feeling less like a partner, believing not enough time was spent with their child, and believing the provider wasn't sensitive to their family values and customs. In 2009-2010, Black parents were less satisfied with the provider's listening, time spent with the child, and sensitivity than white parents. In 2009-2010, Latino parents were less satisfied with the time the provider spent with their child than white parents. There were no differences in disparities between 2005-2006 and 2009-2010, meaning racial disparities did not reduce over time. This study is important because it shows racial disparities for children with disabilities in the healthcare system. Racial and ethnic disparities often relate to poor health outcomes for many people of color. This Accessible Research Summary Brief series is brought to you by the Institute on Disability and Human Development at University of Illinois at Chicago.